Our goal is not to go out on strike. Our goal is to get a good contract.
I'm your senior reporter, Danny Valle, here in Lansing. The holiday season is approaching, and as many are getting ready to wrap up gifts, a union is hoping to wrap up negotiations for a new contract. Healthcare workers at Health Sparrow in Lansing are on the brink of striking. They're the latest group of workers in our neighborhood picketing for better pay and working conditions. An expert I spoke to at Michigan State tells us why we can expect to see more of these demonstrations.
A week before the holidays, negotiations persist between caregivers and executives at Health Sparrow in Lansing. Last week, nearly 99% of workers voted to authorize a strike if necessary.
We have a membership that is absolutely engaged and committed to getting a good contract. The odds to whether or not we'll have to go out on strike are in the hands of the employer.
Jeff Breslin is a registered nurse at the hospital, and he's leading negotiations for coworkers as part of the Michigan Nurses Association.
We need to have an increase in pay. We need to have an increase in benefits, and we need to have safe working conditions. They need to be safe for us, and they need to be safe for our patients.
It's the latest fight for fair wages and better working conditions in our neighborhood. Last month, workers in Jackson reached a deal with Eaton Aerospace on the heels of an 8-week strike.
Workers feel like something's not fair. Strikes can be very effective.
Maite Tapia is an associate professor at Michigan State, specializing in human resources and labor relations. Tapia says growing support for unions and the widening gap of executive and employee pay may fuel future strikes elsewhere.
There are also these spillover effects in which workers look at each other and see what's possible. There could be more strikes from workers in sectors that we usually don't see.
Breslin says negotiations will continue this week, and if there's no deal, they'll give the hospital 10 days to prepare for a strike. And that, Breslin says, could further strain staff.
And people that are currently working are going to look elsewhere for employment. We've already had people leave.
In a statement, Health Sparrow said that they're, quote, currently planning to ensure safe staffing levels if a strike occurs, and that the hospital looks forward to working in good faith to negotiate a fair contract for team members. And Tapia says a strike is more of a risk for workers than it is for businesses.
A strike can also hurt the business, but probably is going to be minor in comparison to when workers go on strike. That's a big pay cut for the workers.
In Lansing, I'm Danny Valle, Fox 47 News.